Okay, so now we know what blood pressure is and why it's important. What is actually a normal blood pressure then? There's some conflicting evidence on what, a normal blood pressure is, as different societies have different cutoffs for different things. One set of guidelines called the JNC8 says that hypertension shouldn't be diagnosed until the pressure is 140/90. However, the American Heart Association and the American College of Cardiology would formally diagnose hypertension at 130/80. Now, that might kind of seem confusing, but let's take a little deeper look as to why there might be some difference. First of all, I want to take a step back and explain that these organizations are making recommendations for a huge amount of people. In fact, they're pretty much making these guidelines for the entire country. With that being said, their goal is to look at the population health perspective, meaning how can we do the most good for the most amount of people, and they aren't concerned with the individual cases. So the JNC8 recommendations for hypertension are based on numerous trials, but the major trial they looked at was the Accord trial, which didn't show statistically significant morbidity or mortality benefits in diabetics who were treated with stricter blood pressure control. On the other hand, the American Heart Association and the American College of Cardiology used the SPRINT trial to base their recommendations, which found that there were mortality benefits from stricter blood pressure control. And in fact, they felt so strongly about it that the study was stopped early because they felt it was such a huge benefit that they saw. So which one is correct? That depends on who you ask. For my personal practice, I tend to think about it as a stepwise approach to lowering blood pressure. If a patient of mine is not below 140/90, then that's where I start. Based on both definitions, we would know that this patient has hypertension, so it would be best to help get them lowered. Then, from there, we can have a further discussion about trying to lower their blood pressure even more if they have the capacity to do that. Ideally, I want to get my patients in step with the AHA and ACC guidelines because I feel like overall a slightly lower blood pressure is not a disadvantage and the potential benefits could be quite big. So for me, it's more of an optimization thing. If someone's blood pressure isn't controlled at all, then I'll shoot for more reasonable targets to get known improvements in the outcomes and then build confidence that we're moving in the right direction. Then, if a patient wants to optimize things, I would try to work with them to try to get it even lower to minimize the risk for future issues. Now you might be asking, how low is too low? And honestly, it doesn't have a hard endpoint, but we typically say that if you are having symptoms like lightheadedness or dizziness, then we might be a bit too low. This is something you should chat with your physician about, but I did just want to mention it because it is possible to go too low, although that generally is an issue with most people as they're usually run on the higher side. If you found this helpful, it would mean the world to me if you liked, commented, subscribed, or shared it with a friend. Thanks so much for joining me today. Now get off the internet, go be active, and enjoy your life. We'll see you next time.